Hi, everyone, and welcome to the very first episode of Field of Vision with me, Nikki D. So, if this is your first time here and you recently heard the word glaucoma and felt that quiet wave of panic, I want you to know right away that you are not alone. This podcast exists because I remember exactly what that moment felt like. I was actually at my doctor's appointment with my son, who at the time was only an infant in a car seat. And I remember, like it was yesterday, getting that diagnosis that I had glaucoma, and it was pretty scary. Field of Vision is a place where we talk honestly about living with glaucoma, the medical side, the emotional side, and everything in between. I want you to know I'm not a doctor and this isn't medical advice, but I've lived with glaucoma for more than 25 years. And I also spent time working as a medical and surgical technologist in an eye surgery center. So I've seen this condition from both sides as a patient and from inside the clinical world. And my goal with this podcast is super simple. It's to help people like you feel more informed, more steady, and less alone as you navigate this diagnosis. So, I want to start off by talking about something that almost everyone with glaucoma remembers very clearly the moment they heard the word. And like I said before, I can remember it like it was yesterday. And for a lot of people, that moment isn't super dramatic. It's often said very calmly during an eye exam. Your doctor might say something like, "Your eye pressure is elevated," or "We're seeing some changes in your optic nerve." And then eventually the word comes out, glaucoma. And what's interesting is that doctors often say it very matter of factly because for them, it's a condition they manage every day. They see patients every day with glaucoma. But for you, the patient hearing it, your brain suddenly jumps ahead. And I totally get it because mine did as well. You might immediately think about blindness, vision loss, what your future might look like, even if those things weren't said in the doctor's office. And that's where the anxiety can begin. One thing I've learned from being in glaucoma support groups on Facebook and talking with other patients with glaucoma is that the fear is incredibly common. People often go home and immediately start Googling. You read phrases like leading cause of irreversible blindness, you read progressive disease, no cure, and those words are very heavy. And without context, they can make the diagnosis feel much scarier than it really needs to be. Because the truth is that many people live their entire lives with glaucoma and maintain functional vision. Early detection, monitoring, and treatment have improved tremendously, and they keep improving. But when you're newly diagnosed, you usually don't hear that part first. You hear the worst case scenarios. So, here are a few things I truly wish someone had said to me right at the beginning when I was first diagnosed. First, glaucoma is usually slow moving. Now, of course, there are other forms of glaucoma that can happen, their onset can happen quickly, but most forms, especially open angle glaucoma, which is the one that I have, that can progress gradually over time. That means your doctors are watching patterns and trends that are not just single test results. One eye pressure reading doesn't define your future. Second, glaucoma management is very individualized. So, your optic nerve health, your pressure levels, your visual field tests, all of those things create an overall picture over time. Your experience will not be identical to someone else's. They're not going to be identical to mine or anybody else that you may know of with glaucoma. And that's super important because comparison can cause a lot of unnecessary anxiety. Like, why are your pressures so low and mine are so high, or vice versa? Third, the emotional side of this diagnosis is real. Even though glaucoma is invisible to most people, the mental weight can be significant. You may look completely fine to everyone around you, but internally, you're processing a chronic condition that involves your vision, one of the most important senses we have. That emotional response is completely normal. Living with glaucoma day to day over time, you're going to notice things shift. You begin to understand your numbers. You learn what your eye pressure range is. You learn how visual field tests work, not everybody's favorite and definitely not mine. You learn what OCT scans are looking at in your optic nerve, and appointments start to feel less mysterious. That knowledge can be incredibly empowering because instead of feeling like something unpredictable is happening, you begin to understand the process of monitoring and managing the condition. And that shift from fear to understanding is a big part of what this podcast is about. The reason I created Field of Vision podcast is because I noticed something in many online communities. There is a lot of anxiety. There is a lot of fear, and I get it. That's normal. And sometimes there is misinformation. What I felt was missing was a calm space where someone could talk about living with glaucoma in a balanced, grounded way, not minimizing it, but also not catastrophizing it. Just honest conversation. And if someone out there is sitting in their car after an appointment or lying awake at night wondering what this diagnosis means for their future, I want this podcast to be something they can turn on and feel steadier. So if you're newly diagnosed with glaucoma, just take a deep breath. You have time. You have tools. You have doctors who are trained to monitor and treat this condition. And now you also have a community of people walking the same path. Thank you for being here and for listening to the very first episode of Field of Vision with me, Nikki D. If this conversation helped you at all, consider following or subscribing to this podcast so you don't miss any future episodes. And if you know someone who was recently diagnosed with glaucoma, or maybe they've had glaucoma for many years, you might consider sharing this podcast with them because no one should have to navigate this diagnosis alone. And in our next episode, we're going to talk about once you receive the diagnosis, then what? What can you expect? So until next time, take care of your eyes, take care of your peace, and I'll see you in the next episode. Talk soon.